everyone. It's Victoria Field, co-host of Metabolic Health Summit and co-founder of Metabolic Health Initiative, an organization that's dedicated to revolutionizing health through nutrition. And one way we do that is through our scientific conference. For those who don't know, Metabolic Health Summit is a 4-day scientific conference for both the medical professional as well as for the everyday person who just wants to take a deep dive into the science. And it's held every year in January, and we still have some early bird tickets available. So head on over there because they will not be gone for long. And you won't want to miss it because we sell out every year. It's metabolichealthsummit.com to learn more information. And we have a very special guest today, Dr. Jaime Seeman. And she actually is in the room. I'm going to give her a little intro and then we're going to bring her on in because it's going to be a good conversation all around women's health, which is so important, as is men's health. But women's health in particular is really interesting because we give birth to humans, obviously. And there are a lot of, interesting, I will say, questions, some of which are starting to get answered around pregnancy, low carb, ketogenic diets. And Dr. Seeman has an incredible wealth of knowledge around this because she has actually implemented it into her practice as an OBGYN. So she does have a background in nutrition, in exercise and health science, as well as she's actually a fellow in integrative medicine. She's also a wife. She's also a mother of 3 amazing young girls. And she's just an all-around amazing advocate when it comes to women's health. And it's really hard to find, I would say, an OBGYN that truly believes in low carb, ketogenic sort of lifestyle, if you will. And so I'm excited to bring her in today. So ask your questions if you have them. Definitely give us a tap on the screen. And I'm going to invite Jaime in here. And let's see here. Let's see if Facebook will cooperate today. We're adding you in. There she is.
Hi.
Oh, yay. We have no echo. Yes, it's perfect.
Okay, good.
It's just a Facebook problem. It's not us. It's Facebook. How are you?
I'm wonderful. I just finished clinic. It's a good day, and I'm excited to be here chatting with you.
Yeah, I'm so excited. And thank you for the quick turnaround there from Facebook to Instagram. You know, you never know with technology, I swear.
Gotta roll with it.
But I was telling people how just incredible of a human being you are. And we're so thrilled to have you at Metabolic Health Summit. You're just such a solid advocate for women's health, just what you do just as a physician, but also in the education that you provide people is just, really sort of sets you apart from all the rest. I mean, it's hard to find an OBGYN who also is a huge advocate of low carb ketogenic nutrition and really a person that tells their patients, hey, even before you start thinking about maybe having a child, let's talk about the importance of prenatal nutrition. So you do such a phenomenal job. And I just have to say thank you for that.
That's so kind of you. That's so kind of you. I think what's so unique about the field that I work in is when you're an OBGYN and you're talking about taking care of pregnant women, you're talking about impacting health for generations to come. And I don't think that women actually very honored and blessed to be in the field that I'm in and be able to impact not only moms' lives, but their children too.
Absolutely. And, it really comes from a personal place for you as well. I mean, just how you kind of got into this whole crazy world of low carb ketogenic diets and truly have become just a phenomenal advocate for it. I know it started for you actually around pregnancy, and you were dealing with things like fatigue and thyroid issues and even pre-diabetes at one point. If you want to explain sort of what that journey and that transition for you has been like, not just as a physician, but as a mom as well.
Yeah. So people who don't know me and don't know my background, I grew up as an athlete and I didn't have the best nutrition growing up because I was an athlete. And so I got away with eating kind of poorly. And the collegiate athlete, I played softball for the University of Nebraska. And while I was getting a nutrition and exercise science degree, and I ate, pretty good. We had nutritionists when I was a collegiate athlete. We, were in the gym working really hard. And then after I graduated and I went to medical school, my husband and I got married and we decided to have our first baby. And so I was pregnant as a medical student. But in medical school, I was, I tried to kind of a calories in, calories out kind of thing. And I was trying to watch my weight, but I'll be the first to admit I did not eat super well during my pregnancies. And I failed my glucose testing in that first pregnancy. And then after my first daughter was born, I got diagnosed with hypothyroidism, which can be something that we see postpartum in women. And then I went on to have my second pregnancy within 23 months, failed my glucose testing again, and then a third pregnancy. So I basically had 3 children in 60 months. So they were
Wow.
pretty close together, but failed all of my glucose testing, gained more weight than I should have. And so here I was with a newborn 2-year-old and 4-year-old.
Wow.
And I had some weight to lose, and I knew I had probably some insulin resistance. And so I kind of tried to work on my diet, but here I am. I have a medical degree and a nutrition and exercise science degree, and I was trying all the desperate measures. I'm a tired mom. I'm super fatigued. I'm working many, many, many hours at the hospital. And I did a lot of things out of desperation. And so finally I went to an annual exam, and I was talking to my doctor, and I thought, we should just check some lab work. And I found out I had prediabetes. And it was a big slap in the face as a women's healthcare provider. It was kind of like, okay, I'm just as human as my patients, right? We always kind of joke that doctors and nurses are horrible patients, but I really was. So we really started to focus on nutrition again. And what I really started to discover is we have it all wrong in healthcare. Even what I had learned in my nutrition degree, I realized that just, I can't survive on that many carbohydrates. It just wasn't good for my health. And so we ended up settling on the ketogenic diet about 3 years ago. And it's made such a profound impact on my own health. And it's really spilled over into my clinical practice. So I've completely reversed my prediabetes. My hemoglobin A1C is the lowest it's ever been. I'm off.
I heard 5.0. Is that right?
Yeah, 5.0 was my last A1C. Awesome. All of my biomarkers really they look great. I've used a lot of self-experimentation to kind of figure out my own health before I could help other people. And I don't have fatigue. My energy is the greatest it's ever been. I feel like I'm a better mom, a better wife, a better doctor for what I've kind of found, on a personal level. I'm back in the gym lifting weights again because I have the energy to do it. And my body composition is the best it's ever been. And so now I'm really trying to use that energy for good purpose and change a lot of other people's lives, because I know there's other moms out there that are in that same position. You're postpartum, you're tired, you're fatigued, you think this is just your new normal, and it's not. So I have started to use this in my practice, and we're starting to see a lot more pregnant women coming into the low carb and ketogenic space. That's very scary for these women because we don't have a lot of data. It's hard to study pregnant women, and so a lot of them are doing it just kind of blindly and sometimes without the physician support or medical provider supporting them. And so my goal is let's really look at what the data shows, and let's look at prenatal nutrition and what does the optimal diet for pregnancy look like. These are things I wish I would have known before I had 3 pregnancies. And
right. While going through medical school and everything else. First of all, I don't know how you did that. Amazing.
Really good support from your spouse and your family.
Yes. Who also is on a ketogenic diet now too, which is great.
Yeah. He's a police officer, and he works night shift, and he was suffering from migraines, and he was horribly fatigued, and he would, kind of echo my same story. His headaches are gone. He feels so much better than he did. We were living on the glucose and insulin train. It's been amazing.
That's awesome. Yeah. And I'm sure it's, one thing as sort of a physician to go through school, but to experience what you did, with facing prediabetes and then watching that transformation as you completely shifted your lifestyle. It's so cool to see how passionate you are about sharing that with other people. That's got to be such a moving transformation for you that I'm sure so much of I know you also have a sort of a private consulting business as well. I'm sure that everything that you want to do, obviously you're delivering babies and all that, but I'm sure you have quite the passion to be able to move this forward, because it's still not really something that's heavily discussed where other physicians feel kind of comfortable in implementing that into the mix because it's low carb and gosh, we need carbohydrates and all of these things that are circulating around when, you know, you've seen something dramatically different. I'm sure. What's that transition been like for you as a doctor? I know we've briefly talked about it before, where others in your town, you know, they see some of the results that come out of your practice. I mean, what's that been like for you?
It's been interesting because when I first started, you know, on a personal level, I still was kind of quiet about it. I felt like it really wasn't accepted amongst my colleagues. And when I first started, actually, I was attacked, you know, by a few colleagues in my own community for supporting the ketogenic diet. And what's been very interesting is through my own personal transformation and now working with so many patients, you know, I'm getting patients off medications, and we're seeing such amazing results that I think it's really hard for some of my colleagues to deny, you know, what we're seeing. And that the ketogenic research space is expanding, and we're seeing, you know, you follow the research so closely, and we're seeing so many new studies coming out, but it's going to take time. And, you know, before we had social media to translate that into clinical practice, some of these studies took years to translate into clinical practice, but my patients and I don't have time we don't have 17 years.
Right.
So as you know, over the last couple of years, some of the docs in my own practice now are practicing the ketogenic lifestyle. I have people in my community that are reaching out looking for advice on patients. How do I, you know, how does this look like, you know? And it's, so I do feel like a pioneer, but I'm starting to feel less like a black sheep. And
right.
more like I'm part of the flock, you know, as the medical community really grows and our knowledge and how to take care of these women. And in women's health, I mean, women are not men. A lot of the research out there, you know, is done on men. It's not done on women because we are complex biological creatures with this circadian rhythm of estrogen and progesterone, and just not, you know, as stable physiology as a man. And so women, you know, ketogenic lifestyle for women might look a little different than men. And what does that look like? And so it's been very interesting working with women and how do we optimize ketogenic lifestyle and carnivore lifestyle and pregnancy. And it's been really fun to kind of be at the forefront of that.
Yeah, and you absolutely are. I mean, there's so many different fields. Obviously, this got its start in epilepsy nearly 100 years ago, and it's expanded out. But with women's health, specifically with prenatal nutrition and maybe even like postpartum and whatnot, it's still very like new territory. So the fact that you've got this great experience and you're seeing such incredible results, and two, you know, I'm curious of sort of your perspective of this more, I guess, modern problem as our food supply has kind of changed. All of these things have sort of started to take hold, and you see them on the rise, like gestational diabetes. And I feel like postpartum depression is at an all-time high, and all of these factors that really weren't as big of an issue maybe in years past. What's that like for you? And knowing what you know, I'm sure you've got to you feel like you probably want to help everybody immediately. You know, are you right? I heard you're writing a book to kind of get the message out there. If that, hopefully that's true, because I think that could be phenomenal. But what are your thoughts on this current epidemic and what we're able to do about it? I mean, simply by just, you know, choosing the food that we eat in our fridge a little differently.
So we have a lot of modern problems related to our modern diet. And, you know, when we look at pregnancy care, for instance, we have seen maternal morbidity and mortality increase in the United States. And we have an amazing healthcare system and a lot of money. And we have one of the worst morbidity and mortality rates in pregnant women. And it's kind of sobering because it's like, are we not good doctors? Are we not identifying it? Where is the problem? And one of the biggest risk factors for women is the risk of death in pregnancy related to cardiovascular disease, so things like preeclampsia, diabetes. And when we look at these things, what's been interesting as I'm starting to write this book and look at the research is even things like preeclampsia are related to hyperinsulinemia. So when we eat this many carbohydrates and require our bodies to produce more and more and more and more insulin, there are adverse effects of that. And we're really good at diagnosing these things, but how do we prevent women from even getting them in the first place? And so, you know, we can look at healthcare system issues, and certainly there's a lot of things that need to be changed, you know, in our healthcare system, but how can we prevent these at the root cause? That's what, you know, from my perspective, I have a background, you know, in more preventative and functional and integrative medicine. So I look at it through a different lens than a lot of my colleagues. And so what we really need to do is, how does prenatal, you know, nutrition affect pregnancy outcomes? And there was a large study that came out, the HAPO trial that came out, almost been 10 years now since the hyperglycemia adverse pregnancy outcome trial came out. And what that showed us is, even amongst women who are not classified as gestational diabetes based on our current testing guidelines, there are women who have higher blood glucose and higher insulin in pregnancy, and they have higher rates of pregnancy outcomes. So we really need to be looking at mom's nutrition. Like I said at the beginning of this live, the ability to impact pregnant women is the ability to impact health for generations to come, because we know that those women's children have higher rates of obesity, higher rates of diabetes, higher rates of cardiovascular disease. So we really need to be looking at, and that's something I'll be talking about at Metabolic Health Summit, is really looking at prenatal nutrition and, you know, what evidence do we have and where should we go from here? Because it's a conversation that we need to have.
Yeah, and a powerful one too, to have it with other physicians who might be in the same field. I mean, Metabolic Health Summit is both for the lay person who just wants to get a better understanding. So whether you're thinking about getting pregnant, it might be a great place for you to come and learn from Dr. Seeman, or maybe you're a physician yourself and you really want to take a deep dive and understand what Dr. Seeman's done in her own practice with patients. That it's just so exciting to hear about some of the success that you've had. And I'm sure you're going to take a deep dive into that at Metabolic Health Summit and share that even more so. But it's an exciting time, I feel like, for women. And it's really great to see that I feel like so many women are starting to truly understand, not just like when you get pregnant, the moment you get pregnant, but the years, I mean, really leading up to that moment are critical, especially during that time as well. But, and even postpartum as well. I mean, I would be curious to see what a ketogenic diet, what kind of impact that has. You know, there's so much research that's emerging on mental health as well as, you know, the ketogenic diet. So it's an interesting time and very exciting and really cool to see physicians like yourself that are doing the work in sort of unmarked and unknown territory, when I'm sure it feels a little bit scary, but you're doing it anyway.
Yeah.
Great.
If we can optimize women's health prior to pregnancy, it would be huge. But the pregnancy rate in the United States, a lot of pregnancies are unplanned. And so certainly it's much more complex than would like it to be. But right. Yes, talking about prenatal and postnatal nutrition, because you're right. Postpartum depression, postpartum blues are definitely on the rise. It's a real, you know, problem in America. And I think that postnatal nutrition could make a big impact for a lot of these moms.
Absolutely. And so we're so excited to have you and leading this special interest forum specifically around women's health. And for people who are watching that might not know, Metabolic Health Summit is a 4-day scientific conference where we actually offer CMEs to physicians as well as CPEUs to dietitians as well, which is great because those are two of the people that are sort of on the front lines. And Dr. Seeman is going to be joining us January 30th through February 2nd. So we're so excited to have you. And I so appreciate you taking the time to sort of introduce people. And, you know, I'm sure people already follow you on Dr. Fit and Fabulous right here on Instagram, but you've got a great website, which I believe is drfitandfabulous.com as well.
Yes,
right? And when's the book expected to be released?
Well, I don't have a lot of spare time, so it's been a slow process. So I don't want to make any promises, but I'm next year, in the year that hopefully we can get that in the hands of a lot of women.
Awesome. But they can find you on your website, and you post great educational content, you know, every day, all day. I honestly don't know how you do it all, but thank you for taking the time to chat with me today and for coming out to our conference in January. We're so excited.
I'm really honored. Thanks for having me. And I'm excited to come to California in the winter because I'm in Nebraska.
Hopefully it'll be nothing but sunny skies, beautiful ocean, and amazing. We're so excited that you'll be joining us. And thanks for taking time out of your day. We'll talk to you soon, I'm sure.
Appreciate it. Thanks, Victoria.
Okay. Thanks. Bye.